Charging.
Sarah prepares to trigger the electric shock to Ben's heart.
Oxygen away, please.
If we deliver it at the wrong point, it can cause people to go into lethal heart rhythms and have cardiac arrest.
We're charged to 150.
Yep.
Everybody clear?
Sarah's been called to Resus Bay 4, where a patient is experiencing dangerously fast heart rhythms.
What's happened today?
I started to notice my heart racing.
44-year-old lawyer Ben started having a sudden onset of palpitations at home.
I feel dizzy, lightheaded.
Yeah.
Ben was working away quietly at his desk when his heart started beating rapidly. Sarah can see Ben's heart is still racing, even after bed rest in the ED.
I'm surprised you're not feeling more short of breath with that heart rate. It's going up to like 170. Its heart rate is beating between 140 and 170 beats per minute. It should be between 60 and 100, so it's beating extremely fast.
I can, yeah.
Emergency doctor Scott Taylor will assess Ben's heart and work out the best way to treat him.
G'day there. You Ben?
Yes.
Hey mate, I'm Scott, one of the doctors. How you going?
Thanks.
All right, so palpitations, a bit dizzy, lightheaded.
Correct.
What's happening at the moment is the top half of your heart is fluttering.
Yep.
So rather than beating like this, it's kind of beating like this.
Yep.
And Ben has something called atrial fibrillation, or AF, as we call it, which is where the top half of the heart is beating really fast and in an uncoordinated fashion. And it makes the bottom half of the heart pump faster, and that can cause heart failure, heart attacks, or collapse. We have a very good way and very effective way to put you back into a normal rhythm.
Yep.
We've got the option of performing what's called a cardioversion, where we basically use electricity to shock his heart. So my recommendation, very, very strongly, given that we've got a very clear indication, would be to give your heart some electricity.
Yep.
This is a very safe procedure, and once we explain that this is something that's medically necessary, it does make a lot more sense, and people are a lot more comfortable with that idea. Cool. All right, won't be long.
Cheers.
Ben's wife Rhiannon is a nurse, and while she's used to caring for patients, it's different when it's a loved one.
Seeing someone you love go through any of this is just so much more emotional. Just hard to think about, the next stages.
The couple's two young sons, 10 and 7, are staying with friends. They keep texting dad jokes to try and make Ben feel better as he waits to be shocked.
My wife thinks we should allow our pets to share our bed. I finally gave in. After 10 minutes, our goldfish finally settled down. Okay, that's it. That's all I got. That's the good ones.
Pop some extra oxygen on for you. You want to just tip your head forward for me? That's it.
Right, we might actually get you to pop out to the waiting room. Is that okay? And then I'll come and get you in about 10, 15 minutes. It won't take long for us to do this. Yeah.
Rhiannon will wait outside because the procedure can be difficult to watch.
Sit forward for me.
Sarah places defibrillation pads on Ben. The pads will deliver the shock.
All right, do you have any questions before we get underway?
Ben is anaesthetised for the electric shock.
I'll see you when you wake up.
So that's 50 of propes. You still with us there, mate? Still with us? All right. All right.
It only takes seconds to deliver the shock, but it must be given at a precise moment. If not, Ben's life is in danger.
What we're trying to do here with a cardioversion is basically reset the heart back into a normal rhythm, and we deliver a shock at a certain time in the heart cycle. So when you're ready.
Charging.
Sarah prepares to trigger the electric shock to Ben's heart.
Oxygen away, please.
If we deliver it at the wrong point, it can cause people to go into lethal heart rhythms and have cardiac arrest.
We're charged to 150.
Yep.
Everybody clear?
set the blood pressure cycle to 2 once that's done.
Down the corridor, 44-year-old dad of 2 Ben is seconds from getting his heart shocked because it's beating too fast, a condition called atrial fibrillation, or AF.
Charging.
It's hoped the charge of electricity will put Ben's heart back into a regular rhythm.
It is a relatively high dose of electricity because the actual dose that's delivered to the heart is much smaller because of the tissue between the pads and the heart. It sort of dissolves most of that electricity.
With Ben under a short-acting anaesthetic, emergency doctor Scott Taylor is ready to shock his heart, delivering 150 joules of electricity.
Just triple check that you're synced.
Yep, so we're synced. We've got
Good.
our spikes up here. We're charged to 150.
Yep, all right.
The cardioversion machine is synced to Ben's heart, so the electricity is sent at exactly the right time.
So the bottom half of the heart is beating. It's right at that time that we want the shock delivered. Oxygen.
Oxygen away, please.
If it goes any later, you're delivering a shock as the heart is essentially relaxing, and then the heart can go even more haywire.
Everybody clear? Yep. Shocking. Shock delivered.
Just hope he stays that way. Stay.
We delivered the shock at 150 joules, which in most patients with AF should be enough to put them back into a normal rhythm.
Stay. Nope.
The electric shock doesn't work, and his heart continues in a dangerous pattern of irregular beats.
I was saying stay. I really wanted him to stay in a normal rhythm so that he wouldn't need any further attempts at shocking his heart.
Yeah.
Cool.
Yeah.
I'm going to give him a little bit more sedation.
Yeah.
I was really hoping that being the end of it and not subjecting Ben to either a hospital stay or further procedures.
The team prepares to trigger a more powerful shock to Ben's struggling heart.
All right, so when you're ready, do you want to wind him up?
Do you want it at 200?
Yeah.
Stay. Nope.
In Royal Melbourne Emergency, father of 2 Ben has been given an electric shock to get his heart into normal rhythm, but it's failed.
I'm going to give him a little bit more sedation.
Yeah. Very shallow breathing.
Emergency doctor Scott Taylor tops up Ben's sedation so he and nurse Sarah can shock Ben's heart again. If the shock doesn't work a second time, Ben will need major surgery.
All right, so when you're ready, do you want to wind him up?
Do you want it at 200?
Yep.
So we're at
So
200. Our
synced.
sync's on. Sync charging.
Oxygen.
Oxygen away, please. Everybody clear? Shocking.
Oxygen back on.
Stay.
Maybe.
All right. Good.
The second shock resets the father of 2's heart back into a normal rhythm.
Ben, do you have any pain, mate? Good. You happy if I bring Rhiannon back in? Good, thank you. The highest risk of him having a stroke is the first few weeks after having the cardioversion. So it's really important that we offset that risk by putting him on a blood thinner, which I would hope would only be temporary.
Yeah, you had 2 shocks. Yep. Yeah. So you don't need to worry about anything at the moment. You just worry about taking some deep breaths and waking up. Fantastic. Yeah.
After that, with some good cardiology follow-up, his long-term prognosis should hopefully be excellent. Have a seat. The anaesthetic itself was very uncomplicated. Feeling okay?
Slightly sleepy, but otherwise all right.
Good. All right. Fingers crossed things stay where they are. All right, good job. No worries. I'll be back in shortly, okay?
What was a precautionary trip to emergency turned out to be the day doctors saved Ben's life.
Generally all right. Slightly spaced out, but I'm sure I'll get through in another 10 minutes or so. I'll milk it whilst I can.
It's a great relief to Dr. Scott there's no complications he has to worry about.
You're always a little bit nervous having a lawyer as a patient as well. You want everything to go right and nothing to go wrong.